Severe tooth pain and dental emergencies don't stop happening even during a global pandemic. And even though many people may still be a bit wary of visiting a dentist, ignoring tooth pain will only make your dental issues worse and could potentially lead to long-term issues with your teeth and gums. So how can a visit to the dentist be safe? And when do we need to seek out a specialist? I'm Caroline Blair, joined now by Dr. Alan Gluskin, the president of the American Association of Endodontists. Doctor, first, let's talk about safety amidst this pandemic. Along with standard sterilization precautions, what additional prevention steps are dentists and endodontist offices taking right now to ensure patient safety? And what can we expect when we get there?
Well, Caroline, endodontists are specialists in doing root canal procedures. And so if you have an infection and or a swelling in your tooth and it's related to the nerve of the tooth because something's been neglected or you just have pain, going to an endodontist, a specialist in treating those kinds of root canal pain and swelling, the endodontist will protect you in a number of different ways. They're taking extreme precautions to clean their offices. They use the majority of their instruments are single-use instruments, so no one else has seen that instrument. It is used out of a sterile package and used only on you. And endodontists have 2 or 3 years of schooling so that if you have a toothache in a complicated tooth or a difficult tooth, endodontists use microscopes to magnify teeth 10 to 20 times. They use special rubber dams to place around the teeth to protect you from them and them from you. So they're protecting you with rubber dams and 3D x-rays, so they don't have to put a lot of film in your mouth. They can take x-rays of your teeth around your head.
Very interesting there. What preventative care should we be practicing during this pandemic?
Well, I mean, we all learned this as children. You should brush your teeth twice a day. That is the best preventative. And when you brush your teeth twice a day, if you can floss them at least once, first thing in the morning or late at night before you go to bed, that's the second best preventative. And use a new toothbrush. People don't change their toothbrushes often enough. So getting a new toothbrush every 3 months is probably the best thing you could do, and storing it in a dry place. But good oral hygiene will keep your mouth much healthier and obviously keep your health better.
And we certainly know if something goes untreated, it can cause a lot of issues down the road.
There is nothing worse than being woken up at night out of a sound sleep with a raging toothache, or all of a sudden recognizing that your jaw is starting to swell. That is scary. And if you need a specialist, and a root canal specialist can do it safely, effectively, and painlessly, you want to go to our website at findmyendodontist.com. You can use the search engine to put your zip code in, and a specialist who's had 2 to 3 extra years of training in root canal therapy can solve your issue.
Dr. Alan Gluskin, thank you so much for the tips, and especially about safety.